My name is Apolisi. I'm a DRTB nurse. I'm working for MSF in Kailicha project. Today I'm going to talk about the story of Female X and the implementation of post-exposure management for children and adolescents in Kailicha. Kailicha is the largest township in Cape Town, and with a high burden of TB and HIV. It was also one of the hotspots during the COVID-19 outbreak. Going back to the story of Female X is the female of 5 family members. It's the mother of the house, 1 daughter, 2 brothers, and 1 grandchild. This family has been suffering from drug-resistant TB for more than 7 years. The first family member was diagnosed in 2013 with drug-resistant TB. And between 2015 and 2020, all 4 household contacts have developed drug-resistant TB. 2 of those contacts were under the age of 15 years old. And the most recent family member was diagnosed with drug-resistant TB is a 12-year-old girl. And she was diagnosed with drug-resistant TB in 2020. This young girl was referred to a TB hospital for hospital admission. This was the most devastating moment for this young girl. She was emotionally traumatized and emotional and psychological traumatized. She was very scared of hospital admission, and she was afraid that she would be taken away from her parents, the mom and the family and the loved ones. And she was also stressing out about missing out from school. Despite TB disease in this family, which makes the home of this family a high-risk environment, there was no preventive treatment that was offered to this family, and there was no screening done. But we also need to remember that the standard of care at that time was not catering for all household conduct. So TB prevention and TB screening was only offered to household conduct were under the age of 5, and those under the age of 15 years were HIV positive. There was no single drug prophylaxis, and there was no pediatric formulation. So MSF in Kailicha wanted to close the gap for preventive treatment. So from November 2017, MSF rolled out a pilot program to screen children and adolescents who were exposed to drug-resistant TB in their household. Conduct was recruited in this program and referred to the clinic for TB symptom screening, chest x-ray, and sputum for gene expect to those who were able to produce sputum. So these conducts were followed up for a period of a year, and were not providing any preventive treatment. This program was not successful due to a number of reasons. One, the population that we're focusing on was attending school during working hours, and it was extremely hard to access them. 2, for those we managed to find, they needed to be accompanied by their parents to go to the clinic. That means a mom or a parent and a child need to miss school or work day to go to clinic visit. And we're not providing any preventive treatment. Again, MSF decided, this program then, we managed to enroll up to 39 conducts from November 2017 up to August 2019. Then we MSF decided to change this approach because it was not working at all. Then now our new approach now was to identify DRTB doctors from the local clinics who have passion to screen older children for drug-resistant TB, drug-resistant TB contacts. So we managed to get 3 doctors from 4 facilities. Our aim was for these doctors to lead TB screening in their clinics. This plan was distracted by the outbreak of COVID-19, and then we stopped this plan. In March 2020, MSF decided to change the approach to provide a home-based care, family-centered approach with MSF team, a doctor and a nurse, conducting clinical assessment to exposed children at their homes. Exposed children were identified through home visit or at the clinic. We arranged TB screening appointment with their moms or with their parents or guardians. Contacts were screened positive, or the contacts that we have concerns with, they were referred to the clinic for further investigation, such as chest x-ray and sputum for gene expect. Then doctors will decide to make a diagnosis. For contacts who screened negative, we initiated preventive treatment for a period of 6 months. Fortunately, at this time, we were able to provide preventive treatment because of 2019 new DRTB guidelines. So we also have so exciting opportunities because we had an access to child-friendly formulation, which is dispensable leave of 100 milligrams, which is easy to take. We dispense multi-month refills for preventive treatment in 2 ways. It's either we drop medication at home or we give medication to the index at a routine follow-up visit at clinic. The successes out of this were so great, and we managed to screen up to 94 kids, and out of those kids we managed to detect active TB disease. Out of 90, we detected active TB disease in 8 kids. So those kids were started immediately on DRTB treatment, and they are managed in the community. We do follow-ups via telephone for contacts that we don't have issues, to monitor adverse event, occurrence of TB symptoms, and to assess treatment adherence. So we were following those kids. But if we had concerns, then we do home visit to rectify any issues that may raise. The lessons learned out of this is a family-centered approach was the best solution to screen all household contacts for our DRTB newly diagnosed patient. This is the evidence to the number that we managed to get within a short period of time, because we started this program in March 2020 till today. So it's approximately 1 year compared to the old program that took 2 years and we only recruited 39 contacts. And the other success was to give the kids the dispensable leave, because in the past we used to break and crush pills for these young ones. Now we're so fortunate to have this dispensable leave, and it's so exciting for the moms to give these to their kids because it's easy to give. My take-home messages is Family X highlighted so much that there were missed opportunities to prevent TB cycles from this family. So I urge all healthcare workers to provide preventive treatment to all household contacts. But this weekend is possible if we can only do a family-centered approach, because you cannot screen all contacts if you are at the clinic. You need to go out and see the whole picture of the family and deal with it accordingly. We can no longer afford catastrophic cost in vulnerable families.